Welcome to the final episode of our series with Dr. Ginger Martin. I'm your host, Envy. Thank you for joining us today. In previous episodes, we examined the initial indicators of autism and ADHD and compared these two conditions. Today, we will address the subsequent steps following an evaluation and guide parents on how to navigate the diagnosis process. Dr. Martin, welcome back to our show. Let's dive into post diagnosis steps. So, what actually happens during an autism evaluation? Can you walk us through the evaluation process step by step?
Absolutely. Yeah. So each individual, clinic or provider may have their own, unique process. So I'll share what my process is, which involves three separate sessions. So the first session is an intake meeting, and that allows me to meet primarily with the parents to just understand what's bringing them in, what their concerns are. And I go through a detailed background history kind of to talk about early development and specific questions about social development, language development, behavior, whether the child is receiving any services, medical background, family history, sleep, feeding, all kinds of things. So we want to get as much information, as much background as possible at that intake session. Um, if the child joins us for that session, which sometimes they will and sometimes they won't, but it's helpful if they do join for that session because it allows me to just get to know them a bit, to just observe them. During that session, I'm not, doing any direct evaluation with the child, but I'm observing. So just watching how they play, how they interact with their parents, any specific behaviors that come up can be very helpful just to have that initial observation with no demands placed on the child and in terms of evaluation. I follow that evaluation or that intake session with providing the parents with some assessment forms. So it's helpful to have them complete some rating scales that are either screening tools for autism spectrum questions, or perhaps we're looking at ADHD as well. We would add some screening tools for that as well. And I always ask if there are any providers, whether it's teachers, preschool teachers, therapists, anyone else that they would like to have fill out those forms so that we have some comparison points to what the parents are seeing. It's very helpful to see, the teacher's perspective or the therapist's perspective, since they work with a wide variety of children and have a unique experience and unique relationship with the child. So that's that first intake session. The second session is the diagnostic evaluation, and that's usually a couple of hours long. The child would come back with their parent. For young children, they are always with their parent for the duration of the evaluation. It's very play-based and fairly casual. The ADOS or the ADOS-2, the Autism Diagnostic Observation Schedule, is the primary assessment tool that I would use to diagnose anything on the autism spectrum. And it allows me to interact with the child, to present different tasks and activities with them, and to observe their behavior and their responses. Along with the ADOS, I always include either a developmental assessment or a cognitive assessment. So getting a really full picture of the child in terms of their strengths and weaknesses. It also helps me to present them with some more structured tasks to see how they respond to that. And then I compile all that information, put together a report for the family, and then we meet for a feedback session. So that's the third meeting. And that's typically just parents to go over the results. And so we spend time usually between an hour to an hour and a half to just go over the results, go through the report together to make sure they don't have any specific questions about how the information came out, and talk about a diagnosis if there is one, explain what that means, explain what it means for their child, and then we spend some time talking about the recommendations and the next steps. So it's 3 steps for me. And like I said, for that, it really allows me to get to know the family, to get to know the child. I always say to the parents at the end of the evaluation session to let me know if they think I got an accurate picture of their child, if they were tired that day or, did something in the evaluation that they'd never seen before, or maybe there's something that they did or didn't do that they would say, gosh, I don't know if you really saw everything. I've had families send me videos of their child at home during, meal times because there's something important they want me to see there. Or I've had, children that were too sleepy to participate and we scheduled another session for them to come back. My goal is always to get an accurate picture of the child, but also to see them at their best if possible.
Dr. Martin, you provided great information about post diagnosis. Also, since you mentioned EDOS too, what does that mean and why it is so important?
So the ADOS-2 or the Autism Diagnostic Observation Schedule, it's in its second iteration, and it is definitely considered the gold standard. So it is the tool that is most trusted and most used for autism diagnosis. So the ADOS-2 was developed by researchers in autism spectrum diagnosis, and it continues to be studied and updated and fine-tuned. So now it's in its second edition. So it's something that is continually being updated and adjusted as needed. It's widely used in research and clinical practice, so it provides a lot of consistency in terms of um, the specific tool that is used for diagnosis. The ADOS-2 has 5 different modules, starting at toddler and going all the way through to adult. And so the module is chosen based on the child's or the individual's language development. And so there are, from nonverbal all the way up to adult where we have conversational speech. And so it really provides slightly different variations on what's presented and what the tasks are during the testing based on developmental need or language ability. Um, it's a pretty comprehensive evaluation. It really covers everything. It requires a lot of training and clinical expertise. And so it has kind of garnered its reputation as, the tool to be used in diagnosis.
How long does each evaluation take? Initial, second, so on.
Yeah. So, like the intake session is typically about an hour. The evaluation session is usually at the most 2 hours or so. And then the feedback meeting about an hour and a half. The ADOS itself to administer can take anywhere from 45 minutes to an hour. There's no time limit on it. It's a pretty fluid assessment. You can present tasks in sort of a fluid way. It's supposed to kind of be a very social, play-based interaction. And so it just provides opportunity to note and observe, the 3 different categories of social language, social engagement, and then behavior. And we're looking at pretty nuanced details in terms of exactly what language is used during the evaluation or how often eye contact is used and how it's used. So it does provide a really nice detailed observation.
Dr. Martin, I'm curious, like when you take these evaluations, do you also take other inputs from the external sources, like a school or other inputs?
So all the information that's collected from the intake meeting notes to talking about the concerns the parents are seeing, the parents' forms that they fill out, teacher or therapist forms, and the ADOS is all kind of compiled together. So my job then is to take a look at the detail of what everybody is seeing and what each piece is showing. And then also to kind of take a step back and look at the big picture of what's consistent across domains. So what's consistent with what I observed in the office, with what the parents were reporting, with what the teacher is seeing. And so really to make a firm diagnosis, we want to have consistency in all domains and all areas. The ADOS itself is sort of the diagnostic tool, but it's never the only tool or the only piece of information that is used. I really try to look at everything to make sure there's consistency because sometimes, I'll be seeing something in the room that maybe the parents aren't seeing. And either that means they're not maybe ready to see it or it's not happening at home. And so, again, that's where I always try to say to them, hey, I want to make sure what I saw today is consistent with what you'd say you see at home too. So did I get a good picture of his or her behavior? And so it's helpful to make sure that that's the case. So most of the time, there's a good amount of consistency between parents and the external providers and what I'm seeing. But sometimes it's not. And sometimes I'll have to say, you know what, you didn't come up with a conclusive answer today. And so I'd like to maybe put these things in place. Let's talk about some of these recommendations and maybe we recheck in 3 months or 6 months to follow up and see how we're progressing. And sometimes that can be helpful, but that's probably more rare to have to do that.
Also, like once parents receive a diagnosis, what should they do first? What steps should they take to start supporting their child?
Absolutely. So that's a huge focus for me. Regardless, honestly, if there's a diagnosis made or not, the goal of an evaluation for me, parents came in with concerns, is to help with a plan. So The feedback session, we are always spending a lot of time talking about what could be helpful for the child, what are some next steps, and it's very concrete. So oftentimes, and it may, it's going to vary depending on the child and their age and their needs. But it might include seeking early intervention services, getting the child, into the 0 to 3 program, or, the early intervention before school starts. So between 3 and 5. So seeking out those services, which are free if the child qualifies for them. Looking perhaps at outpatient services. It could be, getting into a speech therapy evaluation or occupational therapy. Um, for some children who meet criteria for autism, we may be talking about getting connected with either ABA services or wraparound. Maybe starting an IEP at the school if the child is old enough for school services. And then if we're looking at an individual more like an adolescent or an adult, it might be looking at some social skills support. So it really does vary depending on how the child presents, what age they're at, what services they're already getting. But that's definitely a big focus is here's the next step. And I try to give parents as much detail and resource to, make those next steps as possible.
Dr. Martin, since you mentioned about IEP, are there any scenarios where you have been invited to IEPs or provided guidance on IEPs in the schools?
Absolutely. Yeah. So, for sure, if the child already has an IEP, that's often a great piece of information for them to bring in and share with me so that I can see what's already been done and what services the child is receiving, how they're responding to it. And I have had some families that will request that I attend an IEP meeting to help be a voice for the child or to help provide information, whether it's about diagnosis or specific supports that could be helpful. So for sure, that could be an important piece of the follow up.
A lot of parents worry about their child's future after receiving diagnosis. What advice would you give to parents who feel overwhelmed at this stage?
I think it's only natural that anytime a diagnosis is given, that parents are thinking about what does this mean for the future, and so that's definitely something that we address. That I allow space for parents to ask those questions and try to respond to them. Of course, I always say I can't predict the future, but I could explain what I've seen, and in a lot of my work, it provided me with the opportunity to see a child for a diagnosis and then to continue seeing them or following them for progressive evaluations to continue the services that they were receiving. And that was a really wonderful part of my job because it allowed me to see progress over time. Every time a child came back to my office 3, 6, 9 months later, there was some progress. And so I always share with families that children continue to make progress in whatever way, shape, or form that means. And so, of course, if we have a child who's presenting with more significant, severe symptoms, the progress is going to look different. If we have a child with more moderate or mild presentation, we're going to see a different level of progress as well. And so I always like to share success stories with families to provide some hope. And I always mention not to ever underestimate a child with a diagnosis like this. I've worked with families who were told, this child will never speak. And then, moving years later, they're fully verbal and in a regular classroom at school. And so progress is always possible. And so again, the more that we dig into the early intervention and more intensive services, the more progress that we will see.
Also, we noticed in your website you mentioned about coping therapies for parents. Can you explain that to our viewers?
Parents are such an important part. Anytime you're working with children, you're working with parents. And so I've been able to really see the way that parents will really rise to the occasion in terms of all of the different, hats they have to wear for their child. But along with that, it's a lot. It's a lot to take on. It could be a lot to manage, just scheduling wise and accessing all the services, keeping track of all of the documentation, and just dealing with the daily behaviors and needs of the child. And so it's very important. And I've become sort of an advocate for parent self-care, mother self-care, because it definitely can drain, and it can be emotionally exhausting to have all of that in addition to the regular demands of parenting and working and all of the things. And so, for sure, I think the focus on stress management and parent self-care is important because parents are truly the center of the child's universe, the center of the household. And so making sure that they're taken care of is very important. So it's taking care of ourselves before we can take care of someone else who's struggling. And so um, that's definitely an important component that we want to make sure is to the forefront. Because this is a very whether it's ADHD or autism, individuals, children with these diagnoses require a lot. And so it's very important that that's acknowledged and that it's something that parents are aware of. The more that they can take some time to de stress or manage their own emotions, the better they'll be able to provide and support their child.